Welcome. My name is Jamie Gary. I am the CEO of Upvision Consulting LLC, and we are the host of the Attorneys Resource Conference, or as you are hearing it, ARC 2026. You can go right to the website at attorneysconference.com to take a look at this opportunity, and we encourage you to get registered. You do not want to miss this opportunity. This conference is designed to provide both a dynamic and a relaxing platform that helps you build networks for your case support. So you will meet experts, you will meet behind the scenes support, you will meet other attorneys, medical providers, healthcare providers that will all have special insights for your casework. So if you're interested in improving your strategy in case litigation, improving your professional practice, and improving your ability to identify and mitigate risk, this is the room you want to be in. So today I bring you Ashley Jefferson. Ashley is one of our presenters, and we're going to begin with who she is. So Ashley, welcome to our video interview, and I'd love for you to share with the audience and our potential audience who you are and what kind of work you do.
Hi, thank you so much, Jamie. I'm so excited to be here and to be a presenter at the ARC 2026. I'm Ashley Jefferson, a legal nurse consultant and the owner of Genesis Legal Nurse Consulting. I help medical malpractice attorneys evaluate cases by cutting through complex medical records, clarifying clinical timelines, and identifying key medical issues that inform case strategy, expert review, and litigation decisions, particularly in obstetric, birth injury, and pediatric cases. I've been a nurse for 15 years with a clinical background that includes pediatrics, obstetrics, pediatric intensive care, and I also have worked as a forensic nurse examiner. I currently work as a pediatric case manager where I cover seven pediatric units for discharge planning at our regional pediatric hospital. I'm the president of the Pacific Northwest chapter of AALNC and a member of the Washington State Maternal Mortality and Morbidity Review Board. I currently live in Spokane, Washington, where I'm also a wife and mom to three kiddos who are 10 and under. And so this helps me keep my work grounded in the real world.
Wonderful. You have an amazing background, and we got to hear you in 2025. You joined us as a presenter and provided us with a great background into your work and topic regarding child strangulation and abuse. And many people, attorneys, healthcare professionals, took some very valuable information away from that presentation. So we're bringing you back again this year. What prompted you to say yes? Why are you coming back? What drew you to come back to ARC 2026?
So ARC just really attracts attorneys who want to truly understand their cases and not just react to outcomes. I was drawn to this conference because it values education and collaboration and provides practical tools, which are all needed in complex medical legal cases.
So what tools are you providing us? Tell us about your presentation in a snapshot. We don't want to give it all away to the audience.
Yes, absolutely. So my presentation is from tracing to testimony, and it walks attendees through a structured approach to reviewing obstetric cases. We focus on identifying critical decision points in labor and delivery, interpreting fetal monitoring patterns, evaluating documentation, and using legal nurse consultant expertise to strengthen case analysis, depositions, and expert testimony.
Wonderful. I'm excited about this. I have a history in obstetrics, but I do not work there now. So it's interesting to me to learn all about it, and it truly is a specialty. Birth injury, obstetrics, fetal monitoring, all of that is a specialty. And I am hoping that the audience has a curiosity, like I do, in regard to your topic. So why is it important that this topic is presented? What's the risk if it is not addressed?
So birth injury cases often hinge on those subtle clinical details. If those details are misunderstood or completely missed entirely, strong cases can be undervalued or improperly analyzed. The risk is failing to connect adverse outcomes to preventable breakdowns in care, which can directly impact litigation strategy and case outcomes.
So for the attendee, thinking about improving case outcomes, whether I'm an attorney, whether I'm a healthcare professional, whether I'm a legal nurse consultant, working behind the scenes. What is it that you would want me to change as a result of attending your presentation?
So I want attendees to ultimately feel more confident engaging with obstetric evidence. That means having a practical framework for reviewing your cases, starting with when the risk factors first appeared, how fetal monitoring evolved, what decisions were made, were they delayed, and whether the documentation supports those decisions. I want them to ask more precise questions of experts and approach fetal monitoring and charting as part of a connected clinical narrative rather than just isolated data points.
Awesome. So when we're talking about really developing the understanding of these types of cases, what do you believe that most medical and legal professionals miss in regard to understanding your topic?
So, a common misconception is that fetal monitoring tells you the whole story just on its own. But in reality, those tracings have to be interpreted in the context of what was happening clinically, what decisions were made, what information providers had. They're not always at the bedside, and how events were documented. Without that context, important deviations in care can be missed, or they can actually be exaggerated almost. We can think that, oh my goodness, the provider wasn't there, but were they ever notified? Did they know something was going on in the 20 minutes since they were at the bedside? They're not there like the nurses, or vice versa. Were they notified and they didn't do anything about it? But at the same time, not every poor outcome reflects a failure in care, and being able to distinguish between those unavoidable outcomes and preventable breakdowns is critical in these cases and ultimately to assist patient care going forward.
Mhm. There's always much more to the story, so I'm excited to see how you will
Absolutely.
fill in those gaps. So, who should be in the room for your presentation? Who do you think should be purchasing a seat to hear you speak?
So ultimately, I think anyone who does birth injury or obstetric malpractice cases, OB nurses who need to help with their documentation, LNCs who might receive these cases and might have a background in kind of one of those subspecialties, but just want that extra overview. But just, yeah, that stronger grasp of medical evidence and how to leverage it effectively in litigation.
Okay, so this is a little bit of insider information to help everybody improve. So that's wonderful.
Absolutely.
So, what is exciting you the most about joining us in August in Grand Rapids, Michigan?
So ultimately, I'm just excited to be at the ARC. It is a space where attorneys and legal nurse consultants can come together to elevate their work and just be together. For attorneys, it's an opportunity to gain deeper medical insight and sharpen how they approach their complex cases. But for LNCs like me, it's a chance to share strategies, learn from one another, and see how our expertise directly impacts outcomes. Being part of that kind of collaborative energy is what I'm looking forward to most.
Wonderful. Ashley, we are so excited to have you join us. Again, for everyone watching this video, the Attorneys Resource Conference, or ARC 2026, will take place August 11 through 13 in Grand Rapids, Michigan at the BOB, that stands for the Big Old Building. Please go to attorneysconference.com, register, and get your seat today. You do not want to miss Ashley's presentation.